I'm Dr. Riambau from Barcelona. I am professor of vascular surgery as well as chief of the department of vascular surgery. I have a lot of experience in aortic field, open and endo. I've science many years, more than 25 years now. In order to be honest, I perform complex cases with C-arm, mobile C-arms, not in our institution. We are performing probably aortoiliac obstructive disease procedures and even some kind of EVA. But in fact, we have two hybrid rooms available. So we prefer to do the more complex EVA or TIVA procedures or patients in our hybrid rooms. But I realized that there are so many institutions that don't have this particular scenario without hybrid rooms, and they are using the advanced C mobiles, C-arm mobile X-ray machines. But for sure, if you add something that could be represent any kind of overlay or some kind of fusion technique, even with this particular more simpler machines, X-ray machines, like the C-arms, you can improve a lot the procedure in terms of safety for the patient, safety for the operators, time consuming, and as well as the conference media consuming. Yeah. We also we need to have the map in the big screen in the same kind of when you see the fluoro and you can see the cine, we can also you need to have the map over there that is reproduce the real anatomy of the patient with this important ROIs, important points of reference, target versus distance or wherever in the same screen. That could be very interesting in order to avoid any kind of loss of time, or you have always present the real anatomy and the anatomy you are seeing in the fluoroscopy. And the big data and supported by the experience collected as a previous anatomies, the decision-making process for specific anatomies, also to coordinate or correlate with the outcomes. That could be very interesting. Is one of the dreams we have in the future, is to have this particular tool, but not as a final decision, because it's just an orientation about your particular patient, because every single patient is different. That particular information coming from the potential artificial intelligence is one of the parameters we need to have, is an extra information. But the final decision is on the basis of different kind of factors. One could be this information as well as your own experience, the experience of the team, and the feeling you have about the patient itself. That could be a very interesting tool for sure, because young vascular surgeons need a lot of inputs, because the endovascular surgery is quite new tool we have in our armamentarium. To review the case is also a very nice tool in order to learn something, especially when something is wrong or something was wrong. Then you can learn about this particular mistake. That is interesting to be registered all the procedures, especially complex procedures, and to revisit for you, for your fellows, or even for your colleagues, and to learn something about and to improve the technique or improve the technology or improve your skills. And for sure it's interesting to have more. After, it could be interesting to have also a good semi-automatic tool in order to evaluate during the follow-up period, to evaluate some kind of variations in diameter and volume of the aneurysm, for instance. More complex could be to analyze how is the flow dynamics in type B dissection already treated, for instance.